Hello and welcome back, or if you're new here, welcome to my channel where I talk about topics related to mental health and where I strive to inform you guys about mental health and various disorders related to mental health. Today I will be talking about schizophrenia and I will be giving an overview of this disorder. Schizophrenia is a serious mental disorder in which people interpret reality abnormally. Schizophrenia may result in some combination of hallucinations, delusions, and extremely disordered thinking and behavior that impairs daily functioning and can be disabling. People with schizophrenia require lifelong treatment. Early treatment may help get symptoms under control before serious complications develop and may help improve the long-term outlook. First of all, I'm going to talk about the symptoms of schizophrenia and what this means. Schizophrenia involves a range of problems with thinking, such as cognition, behavior, and emotions. Signs and symptoms may vary, but usually involves hallucinations, delusions, or disorganized speech and reflect an impaired ability to function. Symptoms may include delusions. These are false beliefs that aren't based in reality. For example, you think that you are being harmed or harassed. You believe that you have exceptional ability or fame. You believe that another person is in love with you, or you believe that a major catastrophe is about to occur. Delusions occur in most people with schizophrenia. Next, I will be talking about hallucinations and some examples of this. These usually involve seeing or hearing things that don't exist. Yet for the person with schizophrenia, they have the full force and impact of a normal experience. Hallucinations can be in any of the senses, but hearing voices is the most common hallucination. Now I will be talking about disorganized thinking as it refers to speech. Disorganized thinking is inferred from disorganized speech. Effective communication can be impaired, and answers to questions may be partially or completely unrelated. Rarely, speech may include putting together meaningless words that can't be understood, sometimes known as word salad. In this section, I will be talking about extremely disorganized thinking or abnormal motor behavior and what it looks like. This may show in a number of ways, ranging from childlike silliness to unpredictable agitation. Behavior isn't focused on a goal, so it's hard to do tasks. Examples of behavior can include resistance to instructions, inappropriate or bizarre posture, a complete lack of response, or useless and excessive movement. Negative symptoms of schizophrenia refers to reduced or lack of ability to function normally. For example, the person may neglect personal hygiene or appears to lack emotion. This can consist of things such as they don't make eye contact, doesn't change facial expressions, or speaks in a monotone voice. Also, the person may lose interest in everyday activities. They may socially withdraw or lack the ability to experience pleasure. The symptoms can vary in type and severity over time, with periods of worsening or a remission of symptoms. Some symptoms, however, may always be present. In men, symptoms of schizophrenia typically start in the early to mid-20s. In women, symptoms typically begin in their late 20s. It's uncommon for children to be diagnosed with schizophrenia and rare for those older than the age of 45. In this next segment, I will be touching on what the symptoms of schizophrenia are in teens. Schizophrenia symptoms in teens are similar to those in adults, but the condition may be more difficult to recognize. This may be in part because some of the early symptoms of schizophrenia in teens are common for typical development during the teenage years, such as withdrawal from friends and family, a drop in performance at school, irritability or a depressed mood, or lack of motivation. Also, recreational substance use, such as marijuana, methamphetamines, or LSD, can sometimes cause similar signs and symptoms related to schizophrenia. Compared with schizophrenia symptoms in adults, teens may be less likely to have illusions, but are more likely to have visual hallucinations. When you should see a doctor. People with schizophrenia often lack the awareness that their difficulties stem from a mental disorder that requires medical attention. Because of this fact, it often falls on family and friends to get them help. Here in this segment, I will be talking about how you can help someone who may have schizophrenia. If you think someone you know may have symptoms of schizophrenia, talk to him or her about your concerns. Although you can't force someone to seek professional help, you can offer encouragement and support and help your loved one find a qualified doctor or mental health professional. If your loved one poses a danger to themselves or others, or can't provide his or her own food, clothing, or shelter, you may need to call 911 or other emergency responders for help so that your loved one can be evaluated by a mental health professional. In some cases, emergency hospitalization may be needed. Laws on involuntary commitment for mental health treatment vary by state. You can contact community mental health agencies or police departments in your area for details on this topic. Now I'll be talking about suicidal thoughts and behavior. Suicidal thoughts and behavior are common among people with schizophrenia. If you have a loved one who is in danger of attempting suicide or has made a suicide attempt, make sure that someone stays with that person. Call 911 or your local emergency number immediately. Or if you think you can do so safely, take the person to the nearest hospital emergency room. Now I am going to touch on the causes of schizophrenia. Keep in mind that it is not known what causes schizophrenia, but researchers believe that a combination of genetics, brain chemistry, and environment contributes to the development of the disorder. Problems with certain naturally occurring brain chemicals, including neurotransmitters called dopamine and glutamate, may contribute to schizophrenia. Neuroimaging studies have shown differences in the brain structure and central nervous system of people with schizophrenia. While researchers aren't certain about the significance of these changes, they indicate that schizophrenia is a brain disease. Next, I will be touching base on risk factors that increase the risk of developing or triggering schizophrenia. These include having a family history of schizophrenia, some pregnancy and birth complications such as malnutrition or exposure to toxins or viruses that may impact the development of the brain, or taking mind-altering drugs such as psychoactive or psychotropic ones during the teenage years and young adulthood. Now I will be touching on the complications associated with schizophrenia if it is left untreated. If left untreated, schizophrenia can result in severe problems that affect every area of life. Complications that schizophrenia may cause or be associated with include the following: suicide or suicide attempts and thoughts of suicide, anxiety disorders and obsessive compulsive disorder, or OCD for short, depression, abuse of alcohol or drugs including nicotine, the inability to work or attend school, financial problems and homelessness, social isolation, health and medical problems, being victimized, or aggressive behavior, although this is uncommon. Now I will be touching briefly on the subject of prevention. Although there's no sure way to prevent schizophrenia, sticking with the treatment plan can help prevent relapses or worsening of symptoms. In addition, researchers hope that learning more about risk factors for schizophrenia may lead to earlier diagnosis and treatment. I hope this video has helped someone that may have questions about this particular mental health disorder, or has answered some of the questions that you might have. That is what I try to do here, is informing all of you about these particular disorders. If you like what I do here at my channel, or this video helped you, please like, comment, or subscribe, because with every subscriber, this is how we build our community, where we can talk about mental health and break the stigma surrounding it. This has been Chris, mental health advocate, and until the next video, I'll catch you on the flip side.